Thank you so much, everyone, for joining. We really appreciate the opportunity and spending an hour of your day with us. Vanessa, thank you very much for the introduction. I think the common thread here with all of us is we are parts of healthcare organizations that recognize this North Star of engagement that's out there, and we are all desperately and urgently searching for the best ways that we can drive engagement. And so Clarity definitely has a dog in this fight, and we wanted to talk to you a little bit today about where we feel is some low-hanging fruit, some underutilized opportunities to help go drive those metrics. And so we're going to spend the time talking today about that. I think the intro that was given is the most formal I've ever heard myself referred to. So if we just distill it down, I have spent my career, so for the last 16 years or so, thinking about healthcare organizations and how they are staying at the leading edge. And in many instances, that's looked like provider strategy work on a consultative side. But for the last 10 or 12 years, it's really been focused on this whole cost conundrum that we've got in American healthcare largely revolves around the axle of, are people engaged and active constituents in their own state of health? And that's really where I've sat through WellTalk in an engagement platform capacity for about 7 years, also at HealthBox, and now certainly sort of taking what I think is one of the most exciting opportunities I've seen in my career as we sit at Clarity. So enough about me. I think there are probably a couple of main bucket of audiences here. And I would guess that most people sit into one of these few, and I'd ask people to go ahead and read the poll question and just answer for me so I've got a sense of the room. I think a lot of people are involved in pushing marketing initiatives, member engagement initiatives, and actively trying to move that ball forward. How are we getting more people involved in our plan, involved in their benefits, involved in their own health? I think a lot of people sit on that side of the house, so that's option one. The other side is I actually arrive at today's conversation because I am deeply involved in the logistics of our print correspondence, things that go out and reach those members in their mailboxes. So start thinking about the envelope with the health plan logo on it, the teams of people that are involved in that side of the house. And then of course, I'd be remiss not to say that there's some coffee break folks here, some lunch break folks here. And so if you fall into that other category, then please go ahead and share that one too. And I'll give folks just a few seconds to get their answer in, and then we can keep moving. Looks like we are overwhelmingly we are an engagement audience here. So my guess is we've got marketers, we've got people in charge of clinical quality maybe that are trying to get people involved in these engagement platforms, chronic condition platforms. We've probably got member experience folks on the line, so that's fantastic. This is a really great distribution and actually leads right to where we want to talk from Clarity's perspective. So I'll give you the grand version of who Clarity is, and then I'll give you the simple version. Clarity Software is a company that accelerates member engagement for healthcare organizations. We do this with leading SaaS technologies, and we do it by transforming what have previously been known as check-the-box communications into what we believe they truly are, which is engagement opportunity. Now, if I'm going to tell my in-laws at the Thanksgiving table in a couple weeks what I do, I work at a company that prints and delivers all of the correspondence for over half of the covered insured lives in the US each year. So when you think about the member ID card that's in your wallet or your purse right now, the welcome letter that accompanied it, if you got an EOB because you recently had a visit to the doctor, there's a pretty good chance that Clarity is the back-end company partnering with health plans to data manage, print, and fulfill all of that work. So that's really who we are. And as we've done that work over the course of the last 15 years at Clarity, we've observed that there are hundreds of millions of communications that go to members every year. And we all know this. And the spend is massive So billions of dollars across the industry just to get the paper into the mailboxes. And we have been doing so for so long that we've almost accustomed ourselves to accepting 3 mistakes that Clarity sees get made all the time in this opportunity. The first is that we are treating print correspondence as simply a sunk cost. We're looking at it and saying, as long as that 8.5 by 11 got into the envelope and got out to the member, wipe our hands, we did our job on that. And what that means is mistake number 2 is we're missing the opportunity that every one of those packets is actually a really ripe way that we can nudge engagement a little bit further with the member that's reading it. The last mistake that we make is we categorically treat correspondence as an asset and a communications medium that doesn't warrant success or metric tracking. There's no data and feedback to you and your teams to understand how well did this perform. The only way that we've typically looked at performance was, I don't know, did the color look right? Did it go out on time? Did it reach the person's mailbox? Those have been the traditional success metrics, and we feel like there's more just sitting on the table for us to take from these pieces than that, and that's what we'll start to talk about. Okay, so why are we so enthusiastic about the opportunity here? I think if there has been a theme in the sort of consumer end of healthcare in the last decade, it's that there's a lot of great stuff out there that people could be utilizing to better their state of health and lower their state of cost, but they really aren't doing it to the engagement levels that we all wish they were. And so when I think about the mechanisms that can help drive a person to do a thing, and I'm putting my marketer hat on now, I'm thinking about how visible am I, how resonant am I, and am I really reaching people where they are? And so I am coming back now to, let's look at print as an arrow in your quiver, not an end-all be-all, not a replacement for any other medium, but what are the unique attributes of our correspondence to members that we might lack if we think about text message, if we think about email marketing? One, the open rates are incredibly high. If you get a letter from your insurance provider and you feel that heavy stock of a letter inside of it, it's incredibly unlikely that that's going to be junk mail. And sort of conversely, think about your inbox and how something might automatically get put into a folder or into a spam or whatever that might be, much less get read amid the other hundreds of sort of marketing emails you get. And so when I think about the Trojan horse of getting eyeballs on an actual piece of information, print has sort of reemerged as being a signal through the noise, especially if it's coming from a trusted brand that I know I have an association with, a la my second biggest expenditure after my home is going to be on my benefits. So if you're talking, I'm probably listening most of the time. And doing so for a while, when I open this piece up, I'll spend more time with a piece of healthcare correspondence than I might with another type of consumer marketing email. So when I just look at like the fundamental, why is this an opportunity and why is it, as I said, an arrow in your quiver, we've got to recognize the innate attributes of print coming from health plans to members and recognize that we've really got the microphone for a while and we should be doing the most that we can with that. So this is sort of restating it a different way, but for most health plans out there in the country, we might know all of those things that I just talked through, but we're not pushing ourselves to go beyond just, it landed in the mailbox, call it good. We see this in the form of our service level agreements, our contract SLAs with health plans all the time, where we're really measured on, traditionally, did the packet go out on time? And did it receive at the member's mailbox in high quality? So did it print test well? Did it look nice? Was the paper stock the right one? I'm never going to argue that those aren't critically important, but I am going to argue that they should start to become table stakes. And it's kind of a seed question I want to put in all of your minds today of whomever you're working with, be it Clarity or otherwise, start to just ask those partners that you're working on print with, hey, how do you measure your success? And if the end of the story is, well, we get it out at great quality and we get it out on time, I would argue that the vendor market needs to push itself a little bit further than that to get into the value column with you, not just into the administrative cost column. So when I think about how Clarity looks at it, we're really saying the plans that work with us are optimizing their communications, and we'll talk about and actually show you examples of what that means. So they're not just words on a page, they're a measurable engagement touch point, and the receipt of the letter is just the beginning of the story for you as a business, not the end of the story for you as a business. So we start to ask questions of our clients like, what if we really challenged the nature of what's in that envelope? And what if we said, I want to see it drive 15% more portal registrations, or choose your own number on that one. I want to see it perform in a way that measures up to what I know my marketing executive leadership or my CEO or my engagement team is driving to get more of in this year. What if we were actually oars in the water to help make that happen? Similarly, if we look at member guides, what if we could say that a member guide going to a new member who's just getting oriented into what their benefits look like, what if it could be triggering more people to go down a mail order pharmacy route? And we know that's a huge cost savings for us as a health plan. And I think critically important then, what if we had the data that we could actually prove that this was an effective vehicle in moving people in that direction? One that we'll talk about a little bit later on in our presentation today is really kind of geeking out on EOBs and taking what I think is largely looked at as one of the most sort of dry and boring healthcare correspondence pieces and turning it into one of the most interesting and one of the most strategic from an engagement standpoint. So what if our EOBs and the huge spend that health plans have to go through on an annual basis to distribute them, what if every one of those was nudging a person towards a relevant chronic condition management program? Again, we're not going to change the world in and of itself with print correspondence, but what we know as marketers or as people who are driving engagement, we've got to turn the surround sound on around these members. And every time we have an opportunity to talk with them, we need to help move them in the direction of awareness of that benefit that's going to help them to get to that better state of health, that lower state of cost. And so things like EOBs that are going out at such a high volume per year, if we're not even leaning on those to move things in that direction, we really feel like that, again, is the missed opportunity. So, I mean, fundamentally, this boils down to, I think we've all resigned ourselves, and I'm putting the whole industry in this, of saying print sort of slipped through the cracks. Like it's black and white, it's not tremendously thoughtful copy that we're putting into it, and we've kind of become okay with that. And it's a really interesting thing that this is like the one piece of communication that we have this type of a spend on that we're not demanding more from. And instead, my I guess conceptual pitch, whether it be with Clarity or not, is that the way forward is to make sure that you're putting your print correspondence under the exact same microscope that you would put anything else under, and say this has to not only go out and reach the member in an accurate way, but it has to perform for me. Otherwise, why would we spend so much money on it? So you'll see examples as we go through some of what we're looking at today and talk about measurement and talk about the integration of behavioral science best practices and talk about getting really colorful, consumer-friendly examples out there for your membership to use. One more just sort of PS on this, and this was a late addition slide to this presentation, but truly over the course of the last 10 days, we've been seeing more and more news around how misled people are by the TV commercials that are supporting MA plans. And so there's actually going to be increased regulation and scrutiny on the televised commercial presentation of MA starting in 2023. The point for here is we have unbelievably confused, misled, misinformed, underinformed members out there or prospective members out there. And again, it's created noise. And so when we think about what we can do to pacify and sort of quell that noise a little bit, we've got that opportunity again. I think member trust and member clarity, no pun intended, is really never been more pressing than it is right now. And if I really put my sort of strategy hat on, it's one of the ways that the best organizations are going to start to take market share. They'll be simple, they'll be easy to understand, and they'll build that brand trust through their communication mechanisms. Okay, so that's kind of, I'll put all of that front end of what we just talked about into a little bit of a more of like a keynote feel of what we've discussed. But let's get real. If we're going to make this leap and we're actually going to try and take what for the last 10, 20, 30, 40 years has been a pretty just cost center type of a correspondence, and we're going to ask it to be this very fundamentally different thing, how do we do that? And so I'm now going to walk through a little more of through the factory floor of what does it look like when we start to make this transition and how do we do it? My hope with this is that it gets the conversations going in all of your team meetings as you sort of take the information from this back and start to just ask the critical questions of, could we be doing a little more of X or should we investigate Y? Because it might help us to get this whole spend onto a little bit more of a strategic level. So, you know, again, we're saying this not from the standpoint of this is our theory that we think all of you should do. When we talk about the health plans that we're working with and the over 100 million communications, we are live and doing this now. This has become fundamental to how Clarity operates and is charting the new direction forward. If we're in our internal Clarity meetings, we're saying, thing of the past is only getting things out on time and at high quality. Those, as I've mentioned, are becoming table stakes, and where we really need to go deliver for our clients is in the sense of where is the value out of what we print and distribute. So we'll show you examples of where we've done this in market and a couple of case studies in a bit, but just again wanted to make sure that this is coming from the stance of we're living and breathing this every day. So how? When we look at our engagement platform and really the engine that runs and churns out every piece of correspondence that we create, we start with questions rather than an intake of a letter. We have a consultative conversation, say, well, who do we want to target? Who is the target audience that we want to do a thing? And that could be any one of your commercial members. That could be an MA member. That could be duals. Doesn't matter the line of business. But let's understand who that person is. And then let's understand what is it that we want them to do. So this is really where I mentioned earlier in our presentation, there may be some clinical quality folks on the line. Health plans, all of you know exactly what the difference is between a person being not adopting a particular benefit that can improve his or her state of health and going ahead and adopting that piece of technology or that service or that interaction that they have access to. The marriage of those two things is what we really want to focus on. I mean, buzzword of all buzzwords for 2022, how are you using predictive analytics? The way that I think correspondence vendors should be doing this is saying, who is most likely to do something? And if you just maybe think of one of your members and say, well, I'd love for them to do these 3 or 4 things, but they're most likely to just register for the portal or download the app, maybe we put them in that category so that we know that we get a win from an engagement perspective with them rather than trying to solve all of their chronic condition management problems at once. So predicting what someone is likely to do has become a really key ingredient in how to reach people. And then just talking to them in a way that I think appeals to their senses and the behavioral science techniques associated with consumer behavior. We'll talk actually in some good depth about this and some of the examples we see, but it can't just be we got in a room, we put the words on the page that our bosses told us to put on the page and then sent it. The behavioral science and the presentation of that exact same information can have a huge bearing on if somebody does something about it or if it just lands flat. So including all of those things is really important. And all of that sort of blends together into ultimately something does arrive in that person's mailbox. And the closer it is on that generic to personalized spectrum, the better shot that we've got of it being well received and taken action on. And finally, which I've mentioned at the outset, we've got to measure this. Otherwise, what are we doing? And if someone were to say, hey, I spent X amount on my print correspondence, on my EOBs, on my ID cards this year, what did that do for me? If we don't have a good answer for that, I would argue that we're probably not getting enough out of all of that, that print fulfillment. So we'll look a little bit at that. As we go through this, and I'll just go through quickly, you're going to start to see some bring it to life examples. So maybe you're partnered with Sword Health for musculoskeletal. Maybe your members have access to Livongo for diabetes prevention. And maybe we also know who is most likely to do what based off of our history with those members. But all of these start to be, we can fill in the blanks, right? And the one I want to go deep on today is the behavioral science techniques. This, I think, is, if you're looking for a starting point, this is the easiest one to bring back into a marketing or a correspondence function within your plan and say, are we doing this? And it's a really different thing saying, well, yeah, we wrote it so it would sound really nice and we think they'll like the intro. That's a really different thing than saying we are targeting this specific behavioral science technique that is tried and proven across industries, and we're including it in our correspondence. And we're then measuring to see if that principle worked for this person in this particular situation. That's sort of the level that we would urge to get to in terms of the inclusion of behavioral science. And there's two sides of that. There's the artistry of member engagement through this behavioral science, and then there is the actual science of it. And when I think about that as applied to, we've got a mock letter up here that's just blinded, but first and foremost, are we taking a consumer lens to the piece in general? And when we think about a really flat, black and white kind of a letter, and then we think about just offering an alternative to see how our membership responds to it, it's less about having a vested interest in which one performs better. It's more about understanding the data points of, oh, if I include color, I actually get a better response out of my millennials. But if I include a bunch of color and QR codes, I may get less of a response from a different audience. Well, these are now analytics that you can take towards what I know is top of mind for a lot of people, the open enrollment period. And now we're not just sending out a shotgun version of a letter, but we're actually going down and saying, for this particular age and gender cohort, or this line of business, or this jumbo group, we found these tactics to be the most resonant to drive this action. And so we're going to make sure that anyone that falls within that cohort gets the right marriage of language and color and copy and behavioral science principles, and that's the kit that they're going to get. And so that leads me over to the science side of this, of, in addition to just that, that sort of artistry and having color and really professional design, are we looking at, well, let's include a Johnson box at the top right to make sure that we've reinforced what the call to action is and it can't get lost in the weeds? Are we using things like Zeigarnik effects, where we've got two checkboxes and that last one is going to give us a sense of completeness, and that's where we're going to reiterate the action that we want the member to take? Are we looking at stickers appended to the front of our ID cards, which we are so groomed to respond to from the financial services industry? Whatever is on that, it feels like the on button, almost as though until I do this thing, I'm not getting the most out of what I'm holding in my hand. And so is that another opportunity that we're driving people to download that mobile app, to get that portal registration, to sign up for the mail order program from day one? These are the places where the science can tell us that we can nudge that population a little bit farther. And so let's look at them just in contrast here. The way that we operate, and again, the way that we think gets the most out of the print correspondence, is to actually put both of these things out there into the market. We're going to come back to that when we talk about the measure and manage and the analytics that should be associated with print. But what we'd really like to do is actually, if you've been using a certain letter with your population for the past 15 years or 2 years or however long, let's continue to send that to a pocket of the organization. But let's in parallel put out this new treated, what we would call treated with behavioral science techniques. Let's put that version out too. Because now we're actually going to learn something. When we start to see analytics on these, we can say this one demonstrably performs better. We now have no business reasons to be sending out this version because it doesn't perform as well for advancing our organizational metrics. Now that's an informed decision. Now we're starting to get some real value on the engagement side with something that was already going out anyway. So the place where we can extend this to then, and the other place that we're, probably most excited about the opportunity, is the fundamental nature of what an explanation of benefits document is. Now, I think the easy thing to do when we all hear EOB is start to kind of yawn a little bit, because historically these have been so tabular and so dry and so difficult to decipher. But remember what the ingredients are here. We are coming off of a recent healthcare event in the form of a visit that someone will clearly have in their mind. And we've also got a CPT code, a procedure code. We've got the ingredients to say, I know what that person was doing or feeling or ailed by on the day that that happened. Now, if I start to think about marrying that CPT code with a relevant condition program, it's a strike while the iron's hot sort of mentality. And if somebody has been in for an A1C, it is absolutely the right time to say, you have these programs available to you to support prediabetes or diabetes prevention or diabetes management. That as sort of a marketing billboard is what I truly feel is the most underutilized opportunity, to go back to kind of the title of the deck today. You are already paying for this. The EOB has to go out to the member regardless. You're spending already, you're budgeted already, but we're completely flying by the opportunity of recency and the opportunity to introduce that person to their benefits in a relevant way. So let's talk about the measurement side of this. If we're again putting our marketing hat on, and I think about my, well, let's just do something like a Super Bowl commercial. If somebody invests in a Super Bowl commercial, they are absolutely going to have analytics on what were the ratings and in which households and what were the income levels in those households, and so on and so on and so on. It's a marketing opportunity, and a marketing opportunity is synonymous with analytics to help prove that something was valuable or where it was valuable. More relevant maybe to what we all do day to day, I'm sure everyone is working with some type of back-end tool, at least at their organization, to drive email marketing and to drive emails out to your membership. So whether that's Marketo or MailChimp or something like that, there's no question that you're getting a dashboard back that looks something like this. And I'm picturing being in charge of email marketing for a health plan, and we just sent out the huge annual blast that open enrollment's coming and get involved, and here's the call to action and so on. And I show up to my weekly meeting the next week, and my boss says, hey, how did that email perform? And if I don't have analytics, it's like a big, what is the point of even doing it then? And so I'm trying to keep hitting on this point, because there's really no reason that something like our print shouldn't fall into that same line of logic. I want to know, if I put out 2 versions of a letter to my Medicare audience asking them to get an in-home assessment, I better know which of those was more effective at doing it. And I also better know, maybe one was better with females age 65, and the other was more effective with males age 81. Those are the types of things that I absolutely need to know if I'm going to optimize the spend that I know is budgeted and it costs me next year anyway. And this is what those analytics should look like, and the conversations that come out of these should be really, really robust. So let's put real value on this then, because ultimately the metrics are just a proxy. Somebody opening or taking an action doesn't in and of itself do something for us fundamentally as a business. But let's pull the thread a little bit further. And And let's look at, this is just a roster of actions that might look like some that you're trying to promote to your membership at your organization. But if you want to, in your mind, put your own in here, that's something additional that we haven't captured, be my guest. The point is, if you or your plan leadership were to run into a member on the street, there's no question that you'd be saying, hey, member, you should check this out. This would be a really good tool for you. This is a benefit that you're not utilizing that you could and should. That's the kind of marriage that we've talked about. But if we then look over to the far right, there is an actuarial value that I'm sure your health plans could conjure up to say, every member that we get, we've now increased our lifetime relationship with that. We've lowered our attrition. The people falling off when they go into a Medicare plan is reducing. That has a real dollar value. And so it's, whether you think that a portal registration is worth $9 or $4 or $20 doesn't really matter. It's more the idea that your print should really be closing the loop on exactly how much business value was created by this medium. Now we're showing up at that end of year engagement meeting, the big results meeting, and we can close the loop. We can say we sent these things to these people, this many of them registered or participated in the call to action, and we as a business created this much value as a result. And this is exactly how Clarity is looking at it too. So a couple of recent examples here, but if you're just doing the math and follow me through the example at the left on mail order pharmacy, we've had health plans tell us that inclusion or participation in a mail order program versus a pharmacy in-person pickup, those programs create $350 per member that enrolls and engages in it. So let's say if you're a million life plan and you currently have about 10% adoption in a program like that, if we even move the number, and I say we as generically as the health plan, if we move the number by 10%, we go from 100,000 participating members to 110,000, that's an increase in $3.5 million to the plan. Okay, so now if I look back at, well, how many of those people are responding and joining mail order pharmacy within 7 days after they received a letter from us that asked them to do so? You can start to make the case that we are really mining value because we're nudging people in the right direction, and then we're capturing exactly when and how it happened to create this dollar amount for you. Similar on, same math on the portal registrations. You probably have more member penetration at the outset, so say 300,000 on a million life plan. But again, getting that 10%, 20%, whatever it is, member engagement increase, all of a sudden the dollars start to get really big. And I'm going to echo something I've said probably 5 times already. This isn't a new spend. This is the same darn print piece that's been going to these members forever. We've just never asked them to take that next step. And when we are, we can start to get some really exciting numbers here. So a couple examples that are real life examples of health plans that we've worked with. These are both blinded, but we were asked to support a client who said, look, we've been asked to do anything in our power to get mail order pharmacy a higher registration rate. And the person that worked with Clarity said, like, I can't do it all, but maybe I can do the best I can within just the print that we're putting out. Could you guys help a little bit? So we said, well, go ahead and send us the current version of the correspondence that, yeah, tucked way down at the bottom, it asks people to register for mail order pharmacy, but it might not be that exciting. And so if we're looking at the example on the left, we see that letter sort of in the background. And that was the starting place. So we worked with that group to say, we're going to include some different behavioral principles in here. We're going to add some interesting things like more compelling calls to action, some urgency, things like QR codes that'll just make the lift a little bit easier. And then we'll go ahead and send that out also. What we found is over the course of a 6-month distribution of these letters, 11,320 people joined that mail order pharmacy program. That's the story where we actually went back and said, well, how valuable is that to you? And their actuarial team said, we've got that pegged at $350 per. So that was literally just making adjustments to a letter to talk to that member in a way that he or she would resonate with. And we created $4 million worth of value without additional spend. Now, of course, there's work to get the approvals. We got to make sure that everything stays within the brand guidelines. I don't want to say that there's nothing involved in this, but that is a lot of value for a really low lift, and you're already integrated with whomever your print vendor is, right? You've already done that implementation. All the nuts and bolts are in place. It's just really an exercise of let's polish these things up. Let's include some behavioral science principles, and then let's measure how well they perform. Similar, if we look over on the right, we had a portal registration opportunity with a national carrier and saw over 150,000 incremental portal registrations for every million ID cards. So if your plan, toggle the numbers up or down if you're a plan that works at a huge national scale or on a regional basis, but you're getting this sort of 10 or 15% tick for every one of your ID cards that you send out. And before, you were just kind of leaving that on the table. So again, when I go back to my really kind of like senior strategist lens, these are all of the opportunities that keep us at the more competitive end of our market, because we are now closer to our membership. They're more integrated into our brand. They're getting more value from the spend on their benefits. This is how I don't lose market share, is I optimize every touch point that I've possibly got so that I'm driving that deeper engagement and that deeper interaction. That's, in a nutshell, that's what we wanted to talk about today. I think our close is really just an invitation to, if this was interesting, but it'd be helpful to show your teams that you work with something real that you could look at and maybe do that comparison of here's our current letter, here's what it could look like. And by the way, this could be an analytics fueled version. This is kind of Clarity's open offer, is get in touch with us. You've got the contact information here. We're happy to go through and do mock-ups of what a letter would look like if it included those behavioral principles and we were to start measuring it. So happy to do that for you. And I think our hope is that we just give people something tangible as the next step that they can take out of this meeting. But would love to do that, open the conversation and have that with all of you. For those that doesn't feel right, I hope you've been able to get something from this today. Really, I'll go back to, we feel like this end of the vendor market is underperforming across the board for the health plan industry. And if member engagement is the imperative, then we've got to carry our share of water here. And so I think my other call to action for everyone here is, whether you work with Clarity or not, ask whoever is administering your print for you, look at how much that costs per year, and then ask if you're getting the most out of it, and hopefully start taking steps towards more of what we've been doing here. With that, we've got one last kind of before and after. I think when we opened with our poll question and said, are you on the member engagement and marketing side of the house, or are you on the print side of the house? If you're on that print side, ask the question. A lot of times, though, for marketers, you might not be as familiar with who runs or operates this side of the house. This is the invitation to go dig your nose and knock on some doors and say, look, I know we haven't traditionally interacted as much, but boy, have I just realized that we've got an opportunity here, and I'd love to collaborate with you on how we get into tinkering with these letters so that they are driving that overall organizational metric. So I think that's it for us. If there are questions, then we would love to take them. And so, Vanessa, with that, I think I'll give it back to you.
Excellent. Thank you so much. So we'll now move on to the Q&A portion of the webcast. As a reminder, audience members can submit questions using the question tool to the left of the screen. So for your first question, how much does this cost?
Yeah, great question. So again, one thing that we talked about throughout this is, fundamentally, the product is already paid for because you're invariably already sending correspondence. For Clarity, we just look at this as core to how we do things now. So this isn't additional cost from our perspective. This is something where we say everything, I mean, this is more of an organizational mandate for ourselves. everything that comes out of our shop increasingly needs to be driving strategic value. And so this is what we look at as just kind of core to business more than it is an add-on or an additional cost.
Thank you. How difficult is implementation?
So really big question anytime you're talking about implementations. I would say that if you are already working with someone that's doing this for you, we're not really implementing anything different. So we're not going back to the drawing board and saying, well, if they're going to be in color and if they're going to include behavioral principles or QR codes, that's not really a different thing. It's just a more thoughtful thing. So from a technology perspective, we're not re-implementing. We're just simply taking I think a little bit more of a strategic pen to what has already been implemented.
Thank you. We have time for one more question. With open enrollment just around the corner, is there anything we can do before then to enhance our communications, or do we just need to wait until next year?
Yeah, so what are we sitting at? November 10th. Letters are probably largely already going out. I would look at it this way. This conversation is one that you should start now. And I think there's a little bit of an awakening that needs to happen inside organizations that are so programmed to just send out the black and white letter. So what I would do is, whether it's, take us up on mocking a letter up for you or do one on your own or whatever that is, but start the conversation to say, shouldn't we be sending out something that looks more like this? That should happen now. And with strategists, I think that especially should be something that you're going into your 2023 planning years. Well, if I were starting from an open enrollment standpoint, I would be saying, let's start to get our designs, our mock-ups of what we want to be going out to membership across 2023. That stuff should be starting now, and before you know it, it's going to be January, and you're going to be issuing new cards and new kits and new member guides and new EOBs. The earlier that you start doing these in a really performance-oriented way, the earlier you're going to start seeing results.